Did you know that oral sex can be riskier than many people think? While many consider this type of sexual activity as safer, it can, in fact, transmit several serious diseases. Each year, thousands of cases of infections and sexually transmitted diseases, STDs, are diagnosed in people engaging in oral sex, often without protection. For example, HIV, herpes, and syphilis can be transmitted this way, and symptoms don't always appear immediately. In today's video, we'll discuss the reality of the risks associated with oral sex and how you can protect yourself effectively. If you care about your health and your partner's health, this video is a must-watch. Don't forget to like, share, and subscribe for more information on how to maintain your health. Stay tuned for important tips on how to protect yourself better. What is oral sex? Oral sex is a sexual activity in which one person stimulates their partner's private parts with their mouth, lips, and tongue. This can involve stimulating the penis, fellatio, or the vagina, cunnilingus. While many see it as a lighter form of pleasure, it is important to understand that, like any other sexual activity, oral sex carries health risks. It is part of many intimate relationships, offering an alternative to penetrative sex. However, many people don't realize that even without penetration, oral sex can still transmit STDs like HPV and HIV. The belief that it's a risk-free practice leads to misinformation and exposure to health problems. Therefore, it's essential to understand what oral sex really involves and how to protect yourself properly. Sexual health should be prioritized in all forms of intimacy. The unknown risks of oral sex. Although many people view oral sex as a safer practice, it can present serious health risks. Several sexually transmitted diseases, STDs, can be contracted through oral sex, even without penetration. HIV, for example, can be transmitted through oral sex, as well as herpes, syphilis, gonorrhea, and human papillomavirus, HPV. Additionally, oral sex can cause infections in the mouth and throat, such as gonococcal pharyngitis and oral chlamydia. Another significant risk is the development of oral cancer, which has been linked to HPV transmitted through oral sex. While the risk is lower compared to vaginal or anal sex, the exposure still exists, and many people are unaware of these dangers. That's why it's crucial to be aware that oral sex is not risk-free, and protection, like using condoms, should always be considered to preserve health. Main STDs transmitted through oral sex. Oral sex can transmit several sexually transmitted diseases, STDs, often without the person even realizing. The main STDs include HIV, herpes, syphilis, gonorrhea, and HPV. HIV, for example, can be transmitted through open sores or secretions from an infected person. Herpes, which causes painful sores, can be transmitted even when there are no visible signs. Syphilis and gonorrhea can affect the mouth and throat, causing pain, inflammation, and abnormal discharge. HPV, responsible for genital warts and oral cancers, can also be transmitted through oral sex. To prevent these infections, using condoms and dental dams is highly recommended. Additionally, regular STD screenings and open communication with partners are essential to ensure both parties are aware of the risks and take the appropriate preventive measures. Symptoms of infections acquired through oral sex. Infections acquired through oral sex may not show immediate symptoms, making it essential to watch for any changes in the body. Common signs include sores or lesions in the mouth, gums, or throat, which may indicate herpes, syphilis, or other infections. Pain when swallowing, increased throat discharge, and inflamed tonsils are symptoms of possible infections like gonorrhea or chlamydia. Additionally, the appearance of warts in the mouth or throat could signal HPV. In more severe cases, such as HIV, symptoms may take longer to appear but may include fever, headaches, and general malaise. If you notice any of these symptoms after engaging in oral sex, it is essential to see a doctor for diagnosis and immediate treatment. Early detection can prevent more serious complications. Prevention remains the best form of protection. Prevention. How to protect yourself during oral sex. To protect yourself during oral sex, the best recommendation is to use barrier methods, such as condoms and dental dams. The condom should be used on the penis, while the dental dam, a thin layer of latex or another material, can be placed over the vagina or anus. These methods help significantly reduce the risk of transmitting diseases like HIV, herpes, syphilis, and gonorrhea. Another important practice is proper hygiene before and after the act, such as washing hands and the genital area. Additionally, it's crucial to have regular STD screenings, especially if you have multiple partners or don't use protection. Open communication with your partner about sexual health is also essential. By adopting these practices, you can minimize risks and continue to enjoy a healthy and safe sex life. Impacts of unprotected oral sex on oral health. Unprotected oral sex can affect oral health in several ways. During the act, the mouth comes into contact with bodily fluids, increasing the risk of transmitting diseases like herpes, gonorrhea, and HPV. Additionally, the bacteria present in semen or vaginal secretions can alter the oral flora, leading to infections and inflammation of the gums. The risk of cavities may also be higher, as the pH of the mouth can be altered by contact with these fluids. Sores and lesions in the mouth, such as canker sores, can worsen, and the lack of oral hygiene after the act increases the risk of complications. To protect your oral health, using condoms and maintaining proper hygiene after oral sex is essential. Regular dental checkups and STD screenings are also recommended to ensure your mouth stays healthy and free of infections. Oral sex and transmission of serious diseases. Oral sex can be a route for transmitting serious diseases, many of which are often underestimated. HIV, for example, can be transmitted when there's blood or open sores in the mouth, increasing the risk of contamination. Herpes, caused by the HSV virus, can be transmitted even when no visible lesions are present, through direct contact with infected secretions. Syphilis, a bacterial infection, can also be contracted during oral sex, causing painful sores in the mouth and throat. Other diseases like gonorrhea and chlamydia can affect the throat, leading to pain, inflammation, and abnormal discharge. To prevent the transmission of these serious diseases, it's crucial to use protection, like condoms and dental dams. Additionally, having regular screenings and maintaining an open dialogue about sexual health with partners helps reduce risks and maintain a safe, healthy sex life. Common mistakes. When practicing oral sex. Many people make mistakes when practicing oral sex, mainly because they are unaware of the risks involved. One of the biggest misconceptions is believing that oral sex is completely safe and doesn't require protection. This can lead to the transmission of diseases like HIV, herpes, and syphilis. Another common mistake is not considering the use of condoms or dental dams, which are essential for reducing the risk of infection. Additionally, many people don't undergo regular STD screenings, which may hide silent infections. Another myth is thinking that oral sex cannot harm oral health, but it can indeed affect teeth and gums, especially when there are open sores. Lack of proper hygiene after the act is also a frequent mistake, increasing the risk of infections. Sexual education and adopting safe practices are crucial to avoid these mistakes and ensure a healthy, risk-free sex life. Conclusion: oral sex can pose health risks, especially when necessary precautions are not taken. Sexually transmitted diseases like HIV, herpes, syphilis, and HPV can be easily transmitted, often without visible symptoms. The good news is that prevention is simple and effective. Using condoms and dental dams, along with regular screenings and proper hygiene, can protect you and your partner from these infections. Additionally, keeping an open dialogue about sexual health and not underestimating the risks is crucial for maintaining a healthy sex life. Remember, health should always come first. Don't forget to adopt safe and responsible practices in all intimate relationships. Information and prevention are the best tools to avoid serious complications and maintain your quality of life. Share this video with those you care about and help spread awareness about the importance of protection in oral sex.